And welcome back. Well, erectile dysfunction and low testosterone are two very common problems for men when it comes to their sexual health. There are also a lot of advertisements for pills promising help, but they don't always work.
Yeah, so today we're going to talk about these problems and treatments with proven success. NuMale Medical Center doctors, we have Carlos Feliciano and Dr. Todd Arbiter. They are again with NuMale Medical Center, and you're opening up a new clinic in Chicago. And so you're new to the practice, right?
That's correct, yes.
Congrats.
We're opening up in February.
And where in the Chicago area are you going to be?
The northern metro area in Skokie.
Okay, okay. Will it be very much like the NuMale Medical Center here in Milwaukee?
It will be, yes.
Okay.
So we are opening now. Now we've done our Milwaukee clinic. Now we're extending it to our sister, big sister down south in Chicago. So, and the good thing is we're located right next to Old Orchard Mall. So it'll be a very easy to find.
Yeah, a lot of people recognize that name or they've been there before.
Yes.
So let's talk about the topic that we're talking about today, which is ED, erectile dysfunction. What is it? What causes it? We see a lot of commercials, so we hear a lot about it.
Yeah. So erectile dysfunction is the inability to obtain or maintain an erection. Okay. So many of the men we see come in, they haven't had an erection in many years, and as you can imagine, that plays a big part in a relationship, and it takes its toll. It takes its toll not only on the man, but also on the relationship.
What about the embarrassment factor for men? It's shocking probably for some people to hear that people suffer that long with the problem before seeking help, but I think a lot of it is overcoming that embarrassment factor.
And you're right. And what happens is over time, men just kind of bury it because they don't want to talk about it. When there's a topic like this and they think they're the only one that, no one else has this, and it's embarrassing to go to your buddy or even your regular doctor to really talk about that. And at our clinic at NuMale, the first thing I tell them is, like, this is a different kind of clinic. We're here to really talk about your issues, so we're going to ask questions that you may not be comfortable. And then after the first minute or two, we're laughing, we're really getting into it, and that's where it all begins. That's where the treatment begins.
Well, you guys, you're so easy to talk to. We joke around a lot during commercials, and I think that speaks to the camaraderie around men and the jokes that can go along with it and why it can be so isolating to feel if you have this problem. What about things that we see about on commercials, the Viagras, the Cialis, things like that we see? Is it that there's a lot of side effects or they don't always work for men? What's the issue?
That is correct. So a lot of times you get prescribed the pills, Viagra, Cialis, and for some people it works, for a lot of people it doesn't. And then when it does work, people get side effects. They get the headaches, the palpitations, the flushing. So it becomes a medication that they don't want to use anymore. Those side effects just kind of bury them. What
are other treatments then that you've had success with that work, especially if those pills aren't working?
Well, so one of the things that when you take the pills, it's a pill, affects the whole body. Our medications are, or the treatment modality that we imply and that we tailor to each individual patient. It's not, everybody doesn't get the same thing. One of the important things is it's a rehab. It's a revitalization of the penile tissue. And it increases the nutrients to the area. And the goal with our therapy is over time, we can decrease the amount that you need. Whereas with the pills, a lot of people develop resistance. Either it stops working, or you actually need more to get it to work, or you get the side effects that are undesirable. Whereas with our medication, you, over time with the rehab, kind of exercise, if you will, you increase the vitality of the penile tissue, and you can actually come down on the medication. So that's where the difference is with the medications.
Well, I think it can be one of those interesting conversations between the man and the doctor too, because I would imagine a lot of people start to think it's all in my head. I'm there's something with me, or the female too can think maybe I don't arouse him anymore, and that can be, as you said, a toll on the relationship. How often is it because of low testosterone versus other issues? Is that a common cause?
I think low testosterone is one of them, and that's why it's very important to seek out a physician to talk about this, and that's what we take pride in, because there's heart disease, hypertension, obesity, low testosterone, like you said, as well as diabetes. There's a multifactorial, the medications that you take could cause it too. Some of it is psychological too. So it's very important to get to the bottom of what's causing it. so that you can tailor the treatment towards that.
Yeah.
And what are some of the symptoms of low testosterone?
So some of the symptoms are men start feeling fatigue, decrease in muscle mass, the ability to concentrate, mood swings, crashing in the middle of the day.
So they feel like their wives.
Yeah.
They feel like us.
No comment.
Some mood swings, a little bit tired.
Yeah.
Exactly.
So over time, people just think, oh, I'm just getting old, you
Yeah.
know? And then they come in and, you know, in addition to all the medical problems, we test that as well. And a lot of times when men start the therapy, I'm telling you, they come back like a 180, okay? So they came in very just kind of down, not feeling well. They start the therapy, and when we follow them up, they're new people. We don't even recognize them sometimes. So.
Yeah.
I think the biggest mistake, and what we hear 100% of the time from the men, is, I wish I had called sooner.
Yeah.
And 100% out of 100, they're wishing they had called sooner. So you just need to pick up the phone, get on the internet, make the appointment. That's the hardest step, is to make that appointment.
What's wonderful about that first appointment is this great special that you have going on. It's a $99 consultation special, and here's what it includes: a doctor's exam, ultrasound, blood work to check testosterone levels and PSA, which is the prostate level, plus a test dose of medication. It's guaranteed to work, or your visit is free. And again, it's only $99. Mention the Morning Blend when you call. And here's how you can reach the people at NuMale Medical Center. They're on North Mayfair Road in Wauwatosa. The phone number is 414-982-1402. And you can visit NuMaleMedical.com. And new is NU. Thanks to both of you.
One thing I'd like to mention real quick, there's a very important holiday coming up.
Valentine's
Day. And what better way to show your partner, you know, that you want to change things and get back into the sexual intimacy and change your relationship. And what better way than to, you know, make an appointment and take care of it.
It's awesome.
And bring flowers. Don't forget the flowers.
Yeah, flowers too. Good point.
Thanks, guys.
Thanks, you guys.
Thank you.
You're welcome. Thank you.
Nice to have you.
Yeah, absolutely. Still ahead.